Good morning. Thank you so much for joining us. We appreciate that many of you are joining us from afar, and we wish to acknowledge the land from which our center operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still the home to many Indigenous people from across Turtle Island. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. And in addition to acknowledging this land, our center also commits to learning and striving each day toward truth and reconciliation. Some of this learning and striving has been built into our new strategic plan, which we are here today to share with you. My name is Stella Ng, and I am the Director and Education Scientist of the Center, and I'll guide us through this morning's launch. To get us started, I'm pleased to introduce Dr. Lynn Wilson, who serves as the University of Toronto's Associate Vice Provost, Relations with Healthcare Institutions.
Good morning, everybody. I'm so delighted to be in attendance at the launch of your strategic plan. I'm impressed with the work you've done over the past year leading up to this special event, particularly given the relentless demands brought on by the pandemic. During this worldwide crisis, the faculty, staff, and learners of the University of Toronto, University Health Network, our other TASM partner hospitals, and beyond have benefited from the center's expertise in interprofessional education, research, and care. Many members of the center have contributed to novel curricula and teaching methods, and in thinking about expanded scopes of practice and even new types of healthcare workers. In addition to impacting education, research, and care, your innovations are also influencing health systems and policy. The importance of strong teams has been highlighted over the past 2.5 years, and I don't think this lesson will ever be forgotten. I've witnessed remarkable teamwork across our health professions as rapid decisions and actions have been taken. Our teams have dealt with issues such as ensuring learner safety during clinical placements, developing interprofessional COVID curricula, pivoting to virtual seminars and classes, supporting mask and vaccine mandates by securing PPE and working in vaccine clinics and undergoing redeployment from usual work duties. Effective collaborations and strong relationships have made doing the impossible possible. Our teams have enabled students to graduate and supported faculty and healthcare workers so that they can cope and sometimes thrive. The center is a world leader in teamwork, and you have helped to save lives. Of course, the pandemic is not over, and we continue to have to adapt, create, and cope. Your expertise is more important than ever as we face challenging health human resource shortages and try to shore up our exhausted and often distressed colleagues. So today, you're going to hear some exciting announcements. The best strategic plans are built on a foundation of a strong mission, vision, and values. And the best strategic priorities emerge when there is widespread listening, an appetite for creativity, and new and stronger collaborations. So given the many strengths of the center, I'm sure you will agree that this will be an exciting launch. I'd like to thank you for everything each one of you have done over the past 2.5 years and offer a big congratulations to Stella and her fantastic team. Today, we issue an invitation to collaboration. Thank you.
Thank you so much, Lynn. And with that invitation, we are so excited to announce our new, more inclusive and representative name. We thank you all for contributing to this new name, which sets us up for a meaningfully inclusive, integrative, and inspiring future of learning together for a healthier world. We've had a decade of tremendous success and growth as the Center for IPE. Building on that, we will now be known as CASH, the Center for Advancing Collaborative Healthcare and Education. Our strategic plan development followed a collaborative approach. Thank you for your engagement over the past 12 months. We connected with thousands of community members through conversations, focus groups, surveys, and more. We listened carefully, and you shared generously. Today, I will share each of our strategic aspirations just very briefly, followed by just one example of the many activities that will help us achieve that aspiration. First, we will redefine teams through meaningful inclusion and representation. To do so, we will purposefully invite and integrate new academic programs to contribute to and participate in the IPE curriculum. For example, personal support workers and public health workers. Second, we will integrate curricula, knowledge, and practice by connecting people, places, and programs. In order to integrate, we will build, evaluate, and mobilize impactful and evidence-informed collaborative student leadership opportunities. For example, interprofessional student-led environments that will simultaneously enhance student learning and fulfill health system needs. And third, we will inspire and lead collaboration through partnerships and innovation. In order to inspire, we will collaboratively lead national conversations on health human resources, innovative models of care, and workforce capacity development, a crucial issue for society today. So the creation of this plan was made possible by a team that practices what they teach. I'd like to ask the whole CASH team right now to have your cameras on and just wave hello for a moment. I'd love to see you all. This is a team genuinely committed to learning and growing, and I feel so honored to work with you. I can't say enough good things today in this crisp and efficient launch. So what I'll do is invite everyone who's here with us to check out the team's refreshed bios on our website, as well as our team values, which we truly strive to live each day. And this strategic plan came together because of all of you here. There are so many of you here from around the world. I'd like to ask everyone to just have your cameras on if you're able for a moment so we can see your faces and properly thank you. Thank you so much for being here and for contributing to the center's success over the past decade and into the future. And now I'm honored to introduce Dr. Brian Hodges, Executive Vice President of Education at the University Health Network, by posing a fairly easy question, I think. And that is, how will we work and learn together to create a healthier world?
Thank you so much, Stella, and to everyone that is part of this community. This is very, very exciting, and we're standing on the shoulders of giants who have built this center. Really proud that UHN is one of the many partners in this initiative, closely working with U of T and all the TASN hospital partners. I'm going to answer it with two words. The first one is in this question, and that's together. As Lynn has so eloquently articulated, there have been a number of forces driving us apart over the past few years, and some of those predate COVID. So COVID introduced quarantine, which by definition is apart. Virtual has created some togetherness, but also some separation. And the health professions ourselves are guilty. Our processes of admissions, of exams, of certification, of scopes of practice, of maintenance of competence are all individually defined. None of that is defined by teams or working together. And if there was ever a time, it was COVID, to illustrate why that is fatal to highly functioning education and healthcare system. The second word is CASH. CASH is an acronym, but acronyms become words very fast. And the acronym says important things, but the word CASH is important because CASH has two meanings. First of all, it's a hidden treasure. I had a cache of Easter chocolates when as a kid that I hid away for a year so my brother wouldn't eat them. He still teases me about that. But CASH is also the operating system on a computer that is rapidly accessible and helps us dip into critical information that we need to make decisions. I love this acronym and I love this metaphor. We're facing a health human resource crisis like one we've never faced before. We have all kinds of problems, burnout, shortages, etc. We're only going to solve these together. And I'm so excited that we're creating a cache of expertise, not hidden away, but one that is rapidly and easily accessible for all of us, whether we're in the hospital, the university, the schools, the partners, patients, our partners to dip into. And I want to congratulate Stella and the whole team for getting us to this point, and congratulate you. Long live Cache, and may it never be a hidden treasure.
Thank you so much, Brian, and thank you all. So we promised something crisp and efficient. We are at the end of our session today. If your curiosity has been sparked by this glimpse of our new vision, you can view our full strategic plan on our website. It's easily accessible on the homepage, and we'll share the link in the chat. We invite you to collaborate with us on this journey. Thank you for joining, and wishing you all a great day.